And this was not only a professional failure, but a personal loss, because these people were acquaintances and friends. Louis Fierro, oh, he's gone just a second. Louis Fierro, do we have a... Louis Fierro was a fellow from New York who he liked the Mets, and when the Mets came to town to play the Astros, we both went to the ball game together. So it was, as I say, it was a personal loss and a professional failure. And it always kept in the back of my mind. And so I was made, when I left Houston, I was made chief of cardiac surgery at Temple University. And one of my colleagues, Betty Lausch, was in the Department of Pathology. And she came to me and said, when you did those transplants, did you religate the lymphatics? I said, you can't even see them. How the heck do you think you could religate? She said, well, we should think about the possibility that the clearance, causes, poor clearance will cause the atherosclerosis. So we did 4 rhesus monkeys. I ligated them, and sure enough, within a short period of time, they did develop atherosclerosis. So I thought, well, if that can happen in the acute stage, that you can ligate, tie it off, maybe in chronic settings where the lymphatic flow is low, or sclerosed, or constricted, maybe over time, in the usual sense, perhaps that could cause atherosclerosis in the ordinary way. But it was a bit of a reach, because, as you know, as you can see, the disease occurs in the endothelium and in the intima, and the lymphatics from the adipose tissue go into the middle third of the media. So the cholesterol had to go a long way to get there. The other thing is the lymphatics were like a secret river, mysterious circulatory system. Very little research then and even now on lymphatic systems. But it's interesting because it was necessary for life. It was essential for fluid exchange, for protein exchange. It was the immune domain and necessary for lipid and fatty acid transport. What affected the lymphatic flow was the fluidity, viscosity of the lymph, the muscle action of the skeletal muscles pumping the lymph, peristalsis, contraction, dilatation, the pressure gradient across the lymphatic channels, and sclerosis or scarring of the lymph. The lymph fluid itself can be very watery or viscous, like almost like a gel, and that depends on the hydration and the compounds that would affect it passing through it. We knew that all the lymph fluid passed through the thoracic chamber in the thoracic duct, and this was greatly dependent on the negative interthoracic pressure and the milking and pressure and massaging of the diaphragm, both diaphragms. And indeed, some people report that you can increase the lymphatic flow in the thoracic duct by 15-fold by vigorous movement of the diaphragm. And we had certain clues that maybe hinted to this postulation. That we knew that it occurred only in the large and medium-sized vessels. We knew that it occurred in the epicardial artery only unless there was cardiomyopathy. Then you could see it actually dipping into the muscle. We knew that the lymphatic sclerosis was in the arterial disease, and there was a poor correlation with cholesterol level and heart disease. Jay Wernicke from University of Washington, who's professor and chairman, said that you had a better chance of diagnosing cardiac disease by flipping a coin than you did by getting a lipid profile. His expertise is HDL metabolism. We know that shallow breathing and sitting can increase cardiac disease, and it occurred in unmuscled areas like the neck or the groin. Now, there are factors in atherosclerosis. There are beneficial factors and harmful factors, but they don't seem to jive up. They are disparate. The harmful factors, as we all know, are smoking, obesity, hypertension, lack of exercise, diabetes, poor diet, stress, CRP, homocysteine, cholesterol, infection, trans and saturated fats, and other things. And the beneficial ones are exercise, good diet, vegetables, stress modifiers, deep breathing, omega-3s, massage, meditation, yoga, positive attitude, prayer, green tea, and other things. And the only way you can correlate all these, good things is through a lymphatic linkage between the heart and the immune system. So over the 6 or 7 years that pursued, we got real busy. We were doing about 1,500, up to 1,500 open hearts a year, and the laboratory research kind of faded away. It usually happens when you get busy. So, but it always in the back of my mind, and I noticed, that with patients who were doing coronary bypasses on, there were sclerotic lymph vessels along the epicardium. You can see it right there. And we knew and we saw that in the 70s and 80s, this was not known, but it's pretty well known now, but we knew that you could get cardiac disease, coronary disease from radiation, and that caused sclerosis.